Okay, Ka, so let's update with the news this morning. Let's start our morning Wednesday, 19th of January 2022 with CCSA is likely to consider to reopen Thailand as the country's COVID-19 situation stabilizes. So tomorrow or Thursday, the super committee in charge of administering COVID-19 situation will hold a special meeting. And I think the meeting will discuss what many people would like to hear. So Prime Minister Prayut Chan-o-cha will chair the meeting of the Center for COVID-19 Situation Administration or CCSA. The meeting will discuss moves to ease restrictions and reopen the country. This information was confirmed by Public Health Minister Anutin Chanvirakul and another government spokesman Thanakorn Wangbunkhongchana. So let's see what we'll be discussing on the agenda. First, the CCSA will meet to re-evaluate Thailand's Omicron outbreak and consider adjusting measures accordingly. Second, the Public Health Ministry will also ask the CCSA to change the COVID control zone in line with the current situation so that restrictions on activities are eased. Third, the meeting will also discuss measures regarding the closure of the country to foreign tourists. And fourth, hoteliers and tourism business operators are calling on the government to resume the quarantine-free test and go scheme. And Test and Go require fully vaccinated foreign tourists to stay just one night in a hotel pending test results. So the Test and Go was indefinitely suspended on January 7 following the emergence of Omicron and a rise in new cases of COVID-19. And as tourism businesses are calling for its return, one of them, of course, is the minor group. They argue that the Omicron apparently causes moderate disease, and Thailand has avoided the worst case scenario of 30,000 cases per day. So, tourism businesses also point to the high level of vaccination as evidence that the country can be safely reopened. Talking about the vaccine, as of yesterday also, the government has provided over 110 million doses of COVID-19. Prime Minister thanked people for helping Thailand avoid the surge in Omicron cases seen in other countries by diligently following restrictions and hygiene rules.
Could be.
Well, yeah, Prime Minister said what Prime Minister said is kind of like right. If the government cannot take care of us, we better take care and look after ourselves. Despite the stable number of COVID-19 cases, I don't think that we should let our guard down. Dr. Yong Puwarawan, expert virologist, wrote on a Facebook post yesterday that Omicron is fast becoming the dominant COVID-19 variant in Thailand instead of Delta. He pointed out that it took Delta 2 to 3 months to replace Alpha as the dominant strain, but it took only a month for Omicron to take over from Delta to explain that most Omicron cases were found among foreigners in December. Before it spread among locals in January, he was citing a study conducted by Chulalongkorn University Center of Excellence in Clinical Virology. In his own words, Dr. Yong said Omicron will become the dominant strain in Thailand this month based on the principle of evolution. Senate's Public Health Commission Vice Chairman Dr. Chalermchai Bunyatlipan agreed that Omicron was taking over as it has infected 97.1% of patients in the country. Just only 2.8% have been infected with Delta. He cited a study conducted by Ramathibodi Hospital Center for Medical Genomics from January 3 to 16 to back up his information. He added that the number of Omicron patients would continue to rise gradually in Thailand and hit a peak in 3 months before falling, but he hopes there is no new COVID-19 variant that spreads faster than Omicron in the future.